So, without further ado, I'd like to introduce our first candidate, Dr. Kyle Yasuda. Dr. Yasuda has been a member of our academy for over 30 years. After 20 years in primary care practice, he transitioned into academics and health policy. Dr. Yasuda is clinical professor of pediatrics and Seattle-King County's Public Health's medical officer for children and families. He is president and executive director of Best Start Washington, a nonprofit organization focusing on nature's influence on child development. His work with the Academy spans from being elected in 1995 as Washington chapter president, appointment as chairperson on the Committee on Practice in Ambulatory Medicine, to his elected as District 8 chairperson since 2011. Please join me in welcoming Dr. Kyle Yasuda.
Good morning, everyone, and thank you so much for attending this session. I am really sorry to inform you that there's no blues band today, and that I just talked to Dr. Shu backstage, and she told me that her musical career came to an end yesterday, so she's not going to be rocking it out. But please convince her otherwise later. First, thank you, Dr. Sweet, for the introduction, and to you and the National Nominating Committee for selecting me as a candidate for President-elect. I'm honored and humbled for this opportunity. And to Dr. Weiss, thank you for going on this journey with me. You know, each morning this summer with a cup of green tea, I would go outside to my tranquil garden and stand on a rock bridge, and I look and watch the sun rise over the Cascade Mountains. In this peacefulness of the mornings, many times I would contemplate, what more can I do for children and pediatricians if elected as AAP president? I've served the Academy as district chair, district vice chair, chairperson of the Committee on Practice in Ambulatory Medicine, and various Washington chapter leadership roles. I was in primary care practice for almost 20 years, academic pediatrics for the next 15, and now serving my county as a public health position. I visited the 15 chapters in our district many times and consistently been briefed by pediatricians about their daily challenges with practice, their struggles with state advocacy, and their increasing stress levels. These concerns I heard in addition to the coming tsunami of other clinical, payment, and organizational issues. Regardless of the multitude of individual practice issues we face, our experience as pediatricians and members of the Academy remind us that being there for kids means that our job is never done. There's always more to come and more to do. I'm constantly reminded that 0% of children vote, and yet 100% of them need good quality health care. The prevention of pediatric burnout, the chronic disease of pediatricians, needs to be addressed now. Our profession of pediatrics is being put continually at risk. No question about the risk. In talking with the pediatricians at the district meetings I've attended, I found many are less satisfied than they used to be. We love our work, the caring for children and families, but the job is hard, and it's getting more difficult. We believe in our mission for families, but the current delivery system is an enormous burden. Time after time I've heard and witnessed the impact on members' family life by the expanded documentation hours at home. The frustration level is high. There's less time to be a parent, a spouse, or to enjoy a hobby like tying flies. Pediatricians need to be healthy, and we deserve to have healthy, satisfying practices. It is totally unacceptable to have research reveal that over 1/2 of pediatricians are burnt out. Recognizing burnt out as a chronic disease should allow us to treat it accordingly. Our members' resiliency needs to be the primary fiber that is integrated into the fabric of our profession. And I pledge to you that if elected, it will be my foremost priority to make happen. However, in working for better health and better health conditions for our members, we cannot ignore the future health of children and families. The AAP Blueprint for Children clearly articulates the scope of child health issues we are addressing nationally. To successfully implement this plan, members, staff, and community partners must all be focused in the same direction. We cannot control the future, but we can help shape it with our expertise and our passion. We are an amazing organization. When we work together, message our positions objectively and timely, we have been an incredible force for good across the country and the world. Whether it is reinforcing the ACA, SCHIP, or reducing the toll of natural disasters on kids, families, and pediatricians, we will always motivate, activate, and innovate to promote what's best for kids and pediatricians. We have a committed and passionate multi-specialty pediatric team that includes the experienced seniors, the skilled and objective mid-career docs, and the energized early career pediatricians and pediatric trainees. Standing here before you, I will continue with what I strongly believe and want to accomplish, that our academy will continue to have a positive impact on children's health. We will improve the landscape of pediatric practices, and our members can and will have healthier, more satisfying professional lives. I will be bold, innovative, and excited to join the executive team to make this happen. Thank you for who you are, what you do for children and families, and for your continued support of our Academy's mission, and last, of course, for your vote. I wish you all a successful meeting, and I look forward to meeting you individually here in Chicago. Thank you very much.